Welcome back to Aging and Awesome. We are joining you from South Reno at Reno Regenerative Medicine, and Dr. Lloyd Decker is here. We're talking a little bit today about joint pain. I'm telling you, is there anybody that doesn't have joint pain as we age? It seems like we all get pretty darn stiff. I thought it was just a part of aging, and then probably it is part that your joints do go, but hopefully you've got some tips on how we can deal with it, avoid it maybe even?
Yeah, we can definitely talk about that.
Yeah? Okay. What causes joint pain?
Well, there's a couple things that can cause joint pain. You can have an injury, if you have a fall or something like that. Yeah, you're going to get injured and you're going to have joint pain, but hopefully that'll be short-lived and you can return to, going full speed. Then there's also, like you said, aging, degeneration. That can cause joint pain, like arthritis and things like that. And that's a little bit of a different story. That happens when our joints don't work like they're supposed to. Joints get inflamed and they start breaking down, and that causes pain.
Well, is that actually something that you should work through, or is that something that you need to let your joints rest?
If you have a degenerated joint, really the best thing you can do, along with, addressing the problem, is keep moving. Because the less you use it, the term move it or lose it, it's true.
Well, what kind of treatments do people generally go after for joint pain?
The standard of care typically is, let's say you have some knee pain. You might start with some ibuprofen or maybe some physical therapy or some chiropractic. If that doesn't work, people end up usually going to an orthopedic doctor.
Yeah.
And at an orthopedic doctor, they might do a cortisone injection, something along those lines. Unfortunately, those are all just covering up symptoms. And typically those symptoms come back. In the case of a cortisone injection, you might get one, it might work for a while, and then that pain starts to come back. And then you might do another one, and that one's not going to work so well.
Because you build up a tolerance to it?
You build up a tolerance and it causes problems. You get an 8% loss of bone in a joint after a cortisone injection. So once the injections aren't working, then you have to go to surgery. And then unfortunately, if the surgery doesn't get you the results you want, the next step is another surgery. And so it kind of gets to be a bumpy road, and that's the standard of care right now.
Okay, so what do you do differently here? How do you go about it?
Yeah, so really what we're trying to do here is we're trying to get people their health back without unnecessary drugs and surgery. And we do that we're trying to create, let's say we're talking about a knee. We're going to try and create the ideal environment in this knee for that knee to heal. And we do that with all the therapies that we do and the cutting edge modalities that we have.
Yeah, and then is there ways to avoid having joint problems, or we're just all going to experience it?
Aging is a thing, but there is a way that you can make it better, and that is you can stay active. You can be at an ideal weight for your body type. You can put good food in your body, and you can take care of yourself. And also, people get injured, things happen, and when that happens, addressing it, taking care of yourself instead of being the person that says, I think this is just going to get better with time. I'm just going to kind of leave it alone. I'm just going to keep doing what I'm doing. Because that's how degenerative problems actually start.
So just strive for overall health.
Yeah, that's really the best thing you can do.
Thank you so much for joining us, Dr. Lloyd Decker with Reno Regenerative Medicine.